Here's an AMI This Week shortcut with Shelby Travers.
Hello, please have a seat. Great, thank you.
Dentist Shelly Stack's first career as an ASL interpreter has become a huge asset for Ottawa's deaf community. Just ask patient Beth Hutchinson.
I have to say, it's just outstanding. And she really has a strong cultural understanding. So I don't need to explain the nuances of what it is to be a deaf person. She gets it, she meets with me, and it's just like any other patient that she engages with. It's extremely comforting, I feel safe, she is fantastic.
Through an interpreter, Beth tells me about one of her past experiences with dental care.
Well, I would say around 20 years ago when I was living in Toronto, there was one particular issue I was having with my teeth. I was experiencing some pain, so I went in to see a dentist for that. There was not any sign language interpreter available at that time. So I sat down with the dentist. We were not having a clear time communicating with one another. I was trying to lip read them, but it was extremely challenging. They asked me to close my eyes and just relax, so I did. They opened my mouth. I thought maybe they were going to put in a tool, but they actually gave me an injection, and it was extremely painful at that. So after that experience, I stopped going to the dentist. I refused flat out.
Until Beth met Dr. Stack, that is. It was a chance gig that inspired Dr. Stack to leave ASL interpreting to study dentistry.
I'd been interested in dentistry from high school. Like I said, I started a dental hygiene program after high school, but I wasn't a mature 18-year-old and it just didn't work out for me. And then I met some deaf students at the school and became interested in sign language and learned that and really enjoyed that career. So I didn't feel like I was missing anything. But when I was working with a dentist, I really realized that I did have a passion for dentistry, and it wasn't quite too late in my in my life to change careers. So I just found a second passion, really.
So the American made the move to Canada to attend Western University for dental school. Now based in Ottawa, she joined the team at Floss Dental Collective. Owner and independent hygienist Amanda Acker instantly felt synergy with Dr. Stack.
During the interview phase, I was pleasantly surprised to hear that dentistry was actually her second career. And her first career revolved around working with people, and also had that overlay of working with people within sort of a health setting. So I appreciated that she was coming on board, you know, having had that career ahead of dentistry. I think it really kind of helps keep the focus on a client-first approach.
Does that pull it off the charting? Is
Yes,
that where it pulls it from?
it does,
Okay.
yeah. We're thrilled to have her here, and as an office, we're also thrilled to be given the opportunity to increase some of our competencies too within the deaf culture and community.
For Dr. Stack, integrating her ASL skills into her practice with patients is the best of both worlds.
That was the difficult part, because it wasn't that I had burned out on my first career and was looking for a second. I still really enjoyed interpreting, and then did have a bit of a grieving period of that, you know, that part of my career being done.
Dr. Stack shares her experience with deaf culture.
Being an interpreter and living in, you know, several locations, I've had an opportunity to be in a lot of different environments with deaf people. So I've been in rehab situations, medical situations, business situations with them. So I have an opportunity to see a wide variety of deaf people in their lives and how they function. And that helps me with my patients. So wherever they're coming from, I've probably, you know, seen their work environment, their life environment in another patient. So I bring that cultural understanding with me to my practice.
And now it's a huge benefit for her patients.
It's freeing. I don't have to think ahead. I don't have to plan ahead in case a misunderstanding transpires and have a backup plan. There's none of that that needs to take place. I can come in and communicate and engage with her directly. It's just amazing.
I think we have a responsibility as healthcare providers to ensure that we are an office that is accessible, that our services are accessible, not only to people who happen to be deaf or hard of hearing, but to the broader population as well.
I knew it would be pretty rare. I'm glad to be in the Ottawa area and be able to, offer services to as many deaf patients as possible.
However, the veneer doesn't encompass the entire